Foley Catheter Care and Insertion Care Teaching Plan. The insertion of Foley catheters are very important, and a lot of objectives and goals are necessary to make this a success for any patient. Proper hand washing, proper sterile technique, proper sterile opening of supplies, and proper insertion are all important. The achieved goals should be reducing urinary tract infections, better known as UTIs, inserting Foleys without contamination, and also properly gathering all the necessary supplies. Aseptically placing Foley catheters to decrease urinary tract infection is the top priority. Aseptic technique is defined as a means of preventing or minimizing the risk of introducing harmful microorganisms into sterile areas of the body when undertaking procedures that breaches the body's natural defense. The male anatomy differs from the female anatomy. Usually, the male has only one os or opening awaiting insertion, whereas a female has two openings: the urethra opening and the vaginal opening. So with females, it is very important to place the Foley into the correct openings. Now, if by chance on the first attempt with the female, you enter the Foley into the wrong opening, don't panic. Just leave the Foley there. Grab another Foley, set it up sterilely, and now you can place it into the correct opening. Never inflate a Foley balloon without seeing urine first. If you do not get urine, press gently on the bladder. If still no urine is present, consult a urologist. This is a doctor who specializes in urinary incontinence and also in problems with the bladder and kidneys. There are several different types of Foleys. You must be careful and select the proper size and never force a Foley into a urethra. Reasons for using a Foley catheter: there are many. Some are urinary retention, critical watch of input and output, comatose or paralyzed patients, physical trauma, and neurogenic bladder, just to name a few. Before placing a Foley, make sure you are well informed on how to insert a Foley. The patient will already be nervous if he or she is awake when the Foley is being placed, and the last thing the patient needs to see is fear or uncertainty on your face. So make sure you're well informed and confident when inserting the Foley. Knowing the parts of the Foley is equally as important. You have the drainage port, which is where urine enters into the Foley to be excreted. The inflatable balloon that keeps the Foley in place. The urine collection device, which allows the urine to enter into the Foley bag. And the fluid filling port that allows the balloon to inflate. Things needed to insert a Foley catheter: you will need gloves, sterile drapes, betadine, providing the patient has no allergies to iodine. If so, check policies and procedures to see what can be a proper substitute. You will also need cotton balls, sterile lubricant, Foley itself, a Foley bag, and a 10 cc syringe with sterile water for the balloon. So now you are ready to insert your Foley catheter. Remember, urine flows downward. So hang the Foley bag below the patient, attach it to the side of the bed. Remember to always secure the Foley. This reduces pulling, yanking, Foley being caught and removed with the inflated balloon. If yanked out with the inflated balloon, this could cause major damage. Any questions? If you have questions, you can also go to the website of www.columbusregional.com to review policies and procedures on insertion of Foley catheters.